That's the beauty of the body and plasticity of our brain and our body, right?
Yeah.
It's like you are capable of change. The main thing is you have to believe that you can do it. Like a lot of people, especially women, feel very hopeless in their bodies because they've been to so many doctors, practitioners, and they've just been gaslit or told that their issues are not that bad, or like they're just not trying hard enough. You're just too stressed. Just don't stress and just lose weight. Like that's the prescription for everything. When we know that that's, again, irrelevant to most things. Stress is relevant, but telling someone to just not stress without understanding, it doesn't make the stress go away. Without giving them strategies or understanding, like community care is so important in public health, and there's just not an emphasis on community care in our culture. Hello, everyone. I'm Surabhi Veitch, the passionate physio. I'm a pelvic and orthopedic physiotherapist, pregnancy and postpartum fitness coach, and mentor, and you're listening to the Public Health Insight podcast.
You're listening to the Public Health Insight podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content.
People envision maternal and pregnancy care, it's usually one-on-one, right? They consider it being with OBGYNs, midwives, your usual doctor, midwife type of situation. They don't think about physiotherapy. So how is physiotherapy, and I know we've kind of touched on it, but specifically, how is physiotherapy an integral part of the care that's provided to people who are pregnant? Not something as a post-care after giving birth, but should it be something that's an integral thing during pregnancy?
Yes, because so many things can either be prevented, and even if we cannot prevent them, because we're not all-knowing gods that we can just snap our fingers and prevent it, but you will, if you experience that condition postpartum, you won't be as scared, you won't be as lost, and you won't be as set back because you'll have that nice prep during pregnancy. So even if you're super nauseous in pregnancy and you can't exercise, that's okay. You can still get pelvic physiotherapy. Even if you're planning to have a C-section, you still are going to have pelvic floor impacts because the pregnancy, 9 months of pregnancy weighs on your pelvic floor, the baby itself, the uterus, everything. So I would say that the other thing is what happens in your pregnancy lasts with you your entire life. Just like puberty, once you go through it, your body's permanently changed. I think a lot of people don't understand that because our society sees this bounce back culture, this women snapping back in the magazines. Wow, look how she looks 10 weeks after having a baby. She's amazing. Or the opposite, where we're like, ew, she's got rolls now. Like, seriously, your body is going to change.
She birthed a child.
You birthed a child. Like, she hasn't slept more than 2 hours a night in like 3 years. Like, let's give them a break. And just like our bodies change permanently through puberty, our bodies change permanently postpartum, some more than others. And so if during pregnancy you understand how to have a hopefully smoother birth, because we have to remember that surgeons, OBGYNs, and midwives, their goal is to get you to postpartum healthily and your baby healthily. Healthy does not equal functioning well. Just like if you get a knee replacement, the surgeon will mark you as a successful surgery if your surgery is still taking hold, you don't have any wound infections, if your mobility is decently good. They're not marking you as successful surgery only if you get back to running, only if you get back to your joys and passions in life. Right. We, as physiotherapists, that's what we're here for. We help improve your actual quality of life. We're not mechanically fixing things. We're not medicating you. There's no quick fixes in physiotherapy. And that's why I think it puts off a lot of people, because our society loves the quick fix. Because we're conditioned to. We're conditioned to want our problems gone yesterday. And really, if like there are people like that who want just medical or quick fix, or they want surgery. It's like, I don't get it. I'm like, do you understand there's risks of death in every surgery? Like actually, or infection or other issues? Like, but
and oftentimes
some
after the surgery, it's very difficult to get back to what it was before because you've had a surgery.
You have, exactly. Yeah. And if we can help people avoid surgery, or if we know they're having a surgical birth, we can help prepare them and prepare them for the postpartum. It's ironic because, yes, there's a lot of people who maybe can't afford physiotherapy because you have to pay out of pocket. In Ontario, for example, there's OHIP-funded medical care, midwifery care, but not necessarily physiotherapy. Yes, you have to pay out of pocket, but there's a lot of wealthy people who can afford upper baby strollers and fancy everything who will still not go get physiotherapy care. And a big reason is I think they're not that bad. They think leaking is normal. They think, oh, I have a little bit of pain with sex, but I'm pregnant. That's normal, right? No, it is not normal at any phase in your life, even if it's your first time ever. So I think when we start to have these conversations, people understand that like whatever discomfort and pain they're experiencing, even if it's very common, it is not necessarily normal or something you have to put up with, right?
Right. Yeah. Yeah. No, I totally understand. And I think that's the part that just goes so hand in hand with public health being preventative. Like, you know, a lot of the policies are usually preventive. Reactive obviously is there, but it requires forethought and it requires hard work. Like physiotherapy requires hard work. You have to go home and do homework and exercises. It's not done within the 30-minute or 1 hour session that you're there in the office for.
Exactly.
And I think that's where I am guilty of it myself. I've been to physio, then did not come home and do the exercises.
Well,
so.
I think a lot of people don't do their exercises because, yes, some people are at max capacity and they're like, I have a baby latched to my nipple and like screaming at me, like I can't. But I think it also depends on your approach. Like I really like to teach people things that they can weave into their day. So it's not like, here's your boring 30 minutes of exercise. Like it's got to be functional, fun, and like actually doable. And for every single person, that's going to be different. That's why Googling pelvic floor workout, back pain workout does not work.
Right.
Because if it was going to work, nobody would have pain. Like some people really think, like Kegels, we talked about that. If Kegels were really going to work, nobody would have pelvic floor issues because it's not that simple.
Not everyone needs it. And not everyone needs it. Yeah.
No. And often it can actually make things worse, right? So I've had doctors tell their clients, just Google back pain stretches. Stretching can often make pain worse. People don't know that. Stretching your neck when it hurts will probably make it feel worse. Even though it temporarily helps, long-term it's going to make it feel worse. So there's a lot of work that's involved. Prevention is not sexy. It's hard to monetize it too because you have to do a lot of research on prevention-based approaches and compare it to a reactive-based approach. I remember early on in my career, I worked at a hospital downtown in the labor and delivery, but I was only sent to people who had major injuries, so like pubic symphysis dysfunction or major trauma. But in reality, every birth is traumatic. Yeah. Even like I had unmedicated births at home with no tearing, but I still had pelvic trauma.
Oh my God, good for you. That's amazing.
I still had birth injuries. So there's no like, oh, if I can only have this unmedicated, quote unquote, natural. I hate when people use that word because all births are natural. You know, there's nothing fake about it. But you know what I mean? Like people think if I only had that dream birth that I wanted, I wouldn't have had these X, Y, Z. And that's not true. I had that dream birth both times. And I still had pain and injuries and stuff just because it is a very difficult thing that our bodies go through. And, you know, it's interesting that people will do more for things that are very normal and common, like aging, age-related changes, wrinkles, and gray hair. People will spend their time. They will box hair dye once a month. They will spend that hour doing that. They will spend their time doing Botox or getting expensive creams and things for their face. Why? Because it's visible and it's, you know, superficially visible, right? Pelvic floor injuries are hidden often. You can wear a pad. Nobody knows about it. And I think that's another reason, you know, people often don't get help. A limp, an ankle injury, you're limping. You're wearing a cast. You're wearing a boot. It's very visible. Pelvic floor stuff is so invisible that a lot of people are suffering. You know, I think it's a powerful thing to be like, if you're on a subway train, if you're in a crowded room, look around and just think 1 in 3 women in that room have experienced urinary leakage.
Yeah.
Could be the room of most confident people that you know. And they're probably still experiencing it.
Yeah.
Right?
It's so common. Like you see it on TikTok, Instagram of like mothers after giving birth, they have a good laugh and then they are like, oh, I, you know, need to go to the washroom. And it's laughed about. And it's funny in the moment, but like you realize like that's obviously something that they deal with on a regular basis. And it's so
could you imagine a
normalized.
bunch of dads laughing about it? Like, could you actually imagine a dad or a man be like, I just leaked? No, it's only women who have this self-depreciating, like, you know, way of being because we're so used to being not believed that we just gaslight ourselves. That's what it comes down to, you know. And I'm not trying to say like it's not. Some of these reels and TikToks are funny, you know, like my kids ask me why I always cross my legs when I sneeze. It's because of them. And I'm like, yeah, that's kind of funny. But it's also, I feel like,
go to a physiotherapist.
yeah. It's like when people this is a totally different topic, but it's like a lot of cultures, it's common and normal, especially back then, to hit your child. And so people will laugh about, I was spanked so hard, I was hit so hard, and they laugh about it because when you laugh about it, it's easier to get through than when you actually sit down and be like, wow, that was not cool. That was not right. It's the same with these, pain with sex, urinary leakage, constipation. It sounds so minor when you actually, it's just leakage, who cares? But it is actually life-changing. People avoid going out of their house. People avoid going to social things. They don't go out with their friends. They don't want to go out to the Jays game because they're fear they won't make it in time to get to the bathroom. This is life-changing. And this is not only happening to old people. These are people in their 20s, in their 30s. And, for people specifically who have had a pregnancy and have been postpartum, people think it's the first 6 weeks or the first year that's postpartum. But you're postpartum for life, which means if you never got the help you needed when you were 1 year postpartum, 6 weeks postpartum, it's never too late. I treat grandmothers and they're like, I finally have time. My daughter-in-law told me about pelvic floor physio. And I'm like, great, you're here. Yes, the changes may be a little bit slower because now you're unlearning 30, 60 years of, habits and behaviors, but change is still possible at any age. That's the beauty of the body and, plasticity of our brain and our body, right?
Yeah.
It's like, you are capable of change. And the main thing is you have to believe that you can do it. Like a lot of people, especially women, feel very hopeless in their bodies because they've been to so many doctors, practitioners, and they've just been gaslit or told that their issues are not that bad or they're just not trying hard enough. You're just too stressed. Just don't stress and just lose weight. That's the prescription for everything when we know that that's, again, irrelevant to most things. Stress is relevant, but telling someone to just not stress without
it doesn't make
understanding,
it go away.
It doesn't make the stress go away without giving them strategies or understanding. Public health is also community care is so important in public health, and there's just not an emphasis on community care in our culture. It's a lot of individualized care, which means people with money can get the care that they need, but the people without are just left to deal with it themselves. And I feel like that's where I'm hoping that things like my podcast, my Instagram, it's public service, right? Some kind of community building of people understanding that they don't have to contribute anything, but they can if they want to. They can communicate with me if they want to, or they can just sit there and learn and, decide if and when they're ready to receive more support. Most people are what's the word? People are lonely. There's a loneliness epidemic, or I don't know what the right word for it is, but a lot of mothers especially are very lonely because
you don't have that village helping you out that we used to have before. What do you find are the biggest barriers in specifically in Canada that you've seen with women being able to access these type of services? Is it the lack of knowledge or the awareness of the services being available? Is it geographical accessibility? Is it a lack of specialists that maybe is the case? And after that, how do you think these barriers are being bridged, if they are currently?
I think the main barrier in my clients, I say type as in my areas of I serve, is lack of time. And they're often women doing the womanly things of quote unquote, cooking, cleaning, childcare, plus they work full time. So until men step up, especially in, heterosexual cisgender relationships where a lot of the times women are still doing it all, until men step up and actually not even allow, I don't like using that word because we don't need permission, but until women actually have space to think, to even have a thought for themselves, to even make an appointment and actually be able to keep that appointment. Because if their kid is sick from daycare or school, it's usually the mom who takes the day off, usually the mom who disrupts her workday. And that is not fair. It takes two to have a child. And until men step it up, women's health is going to be crap. Women's health is declining, right? And we're living longer, but we're living unhappier. We're more stressed. We have more mental health issues, anxiety, depression. And I'm not just blaming this on men, but our society is set up in a very unjust way, and it always has been. But now we're adding on the extra toll of the expectation and the necessity to work full time because bills to pay and it costs so much to live. Plus, we have to have perfect Pinterest, worthy photos and meals. And, women sometimes add this pressure on themselves, but it's also a societal, cultural pressure. And it's, birthday parties are extravagant. I'm like, this is like a mini wedding. Like, what? So there's all the pressure that goes on women. And I think it's lack of time. Awareness is there for a lot of people. Even if they can financially, if you can afford to pay $1,000 for your child's birthday party, you can afford $200 for a physio session, right? But it's this mentality of, well,
it's not a priority.
It's not a priority because my child's happiness is worth more. And our society's put happiness equating to loot bags and fancy birthday parties and signing your kids up for a million activities versus like if a man has knee pain and he can't golf, he's getting physio. He's going for surgery or whatever it is. So I feel like that societal gender norms and is a big contributor. Like women will say, I got to check with my husband before I book in. Men never, when I used to work with more men, like in sports medicine and stuff, I've never had a man say, I've got to check with my wife. I've got to check with my girlfriend. And again, I'm stereotyping for a lot of the heterosexual, like cisgender relationships here.
Yeah.
But if that's the case, like how will women ever move forward and like actually have a healthy body that they are happy about and feel like they can get back to the sports and activities that they enjoy, right? And then financial is another barrier, of course, is everything is going up. People can't afford groceries, so why would they prioritize this? I totally get it. I don't blame them. I just think that it's sad when our societies come to that point where there's more and more people who are food insecure, who just are struggling to get by, who have more mental health issues, especially since the pandemic. And, it's magnified all the existing issues in our society, I feel. And that's where going back to, I live in a community which has like great community centered care, which is really nice. But I wish all communities had that, and also that moms especially had the time to access that. Because great if there's a night out, but they can't get a babysitter or their partner. If they have a partner, their partner is busy, then are always busy, then they're not able to get that time for themselves either.
I think we see this quite a bit in like the older generations for sure, where they're not able to prioritize their care. Hoping it's changing with the younger generation and the relationships there, but
I hope so too.
You're in a global network of specifically pelvic floor physiotherapists, if I'm correct. Is there any conversations about there being lack of specialists that can provide this type of care, or is there actually quite a few of them?
Maybe because I'm surrounded by them, I think there's so many pelvic floor physiotherapists.
Oh, okay, yeah.
I think it's a lot of people graduate from physiotherapy school, have zero work experience, and then take a pelvic health course or courses, and then they call themselves pelvic floor physiotherapists. Do not go to those pelvic floor physios, not because I don't think they're competent, but because you're going to someone who doesn't even have experience treating an ankle, which is a very simple joint and injuries to treat. Pelvic floor issues, they're more complex because they're a more intimate area of your body. I encourage people to have work experience, life experience before then they go into pelvic health. And so there are tons of specialists, whether they're good specialists.
Hard to say. Yeah.
Hard to say. Whether they have an experience working with people of color, again, hard to say. A lot of the models in a lot of the pictures and models we use in physiotherapy are, again, white, look a certain way, they're thin bodies. So, how are we going to extrapolate from that to the average person when we can't even imagine that there's vulvas that look like this and body parts that look like that because we've never seen it in our learning.
Yeah.
I think there's lots of people who are specialists, but I don't know if they're all good at what they do. Access is another big thing. A lot of people without cars or without ability to like leave their newborn at home to go to the office to get care. Like that's why virtual care is a huge model that's growing rapidly now because we're seeing amazing results for everything from painful sex to urination to prolapse. I treat like 75% of my clients virtually. And they might say, I want to come in person. I feel weird about doing virtual. And then they'll start with in person and they'll be like, you know what? I don't need to come in. Like, let's do the next one virtual. And I'm like, let's try it and see what you like. And if you don't like it, you can come back in person. And then they try it, and then they're like, this was so convenient. I only had to take a half hour off instead of an hour and a half to get to your appointment, to come back home. You know what I mean?
Yeah.
So in a time-starved society, I think it's a huge improvement.
It also covers that barrier on not having enough time to do it if you just have to carve out a half hour versus an hour and a half.
Yeah,
That's
and then your child can be
cool.
there with you. You can be breastfeeding, you can be bottle feeding, whatever you need to do, change a diaper. Like, I have clients in their pajamas, and then their children wander in, their pets wander in. Like, it's all normal, it's all fine. And I want physiotherapy to work within your life, whatever your life is like, not within a perfect lab-based life where you're a 25-year-old white male with no responsibilities, all the money and time in the world, and you play a sport. Like, that is often what is studied. And I think as research expands into covering women's health topics, pregnancy, postpartum topics, I think it will get better, but it's often lagging behind. Like, we need time to get there. And
definitely needs a bit of a more holistic understanding.
And a holistic.
Yeah.
So in my global network, it's not my global network, but in the network that I'm part of, it's called the Women of Color Pelvic Floor Physical Therapy Directory. And it was started by my friend, Dr. Janelle Howell, who is incredible. You should follow her, Vagina Rehab Doctor on Instagram. And, you know, there's probably about 200 people or so in the directory now, mostly from the US and Canada, and then the Caribbean, some in Africa. And it is global, but it could cover more countries. It's just slowly expanding to we need the bandwidth to cover more locations. But why we wanted specifically women of color pelvic floor physical therapy directories, when you Google most directories, it is white, even though the population isn't all white. For example, a city like Toronto, being white is actually, you're going to be in the minority. Yet, when you look at most directories, it is very white focused. And for people, for example, who are very religious or older clients who maybe have cultural norms that somebody from a different culture may not understand, it's really important to remove those barriers, because there's already so many barriers to, like, lying on the table and opening your legs and have someone insert their fingers up you. We don't need to add that on top of it. People need to have that cultural competence, is the word that I like to use. And cultural competence isn't just, because I'm of that culture, I can treat that person. It's not just that. It is an understanding that everybody has a culture. Everybody has things about them that they believe, that the biases about them that they have, including yourself as a practitioner. And it's about being willing to be open and understanding and learn about the other person without inflicting your views upon them, right?
Yeah.
And this directory has helped open up the pathway for more and more clients to actually receive support. We really make sure we plan retreats together. We have conferences that we plan kind of together. We try to support and elevate each other, because like in any profession, we don't get the visibility we need. And often, again, I'm biased, but we are a group of incredible experts. Every day I'm like, this person is so smart, and so, like, they're changing their community in so many ways. And every single person in that directory is like that. So if you're looking for somebody in your local community that you trust, like, check out that Women of Color Pelvic Floor Physical Therapy Directory. And, like, be okay with seeing someone virtually. If you live in a small town with no pelvic physios, don't let that be a barrier. I do virtual coaching globally, right? So physiotherapy only within my province of Ontario, but I coach globally. So I have clients in Korea. I have clients, all across the world, right? Because it's just, that's they found me on Instagram, or they heard about me through someone else, and then they're like, okay, I find someone, I want to go to someone I trust. And so whether it's me or somebody else, like, find someone you trust and actually trust them to guide you.
That's amazing. Honestly, the work you do is excellent. I think the education you provide, honestly, is quite empowering, provides that opportunity for women and anybody else who's reading or consuming the stuff that you put out there, or is accessing your care, to be able to advocate for themselves and their body and what is causing them pain and discomfort. So thank you so much for everything that you do. And thank you so much for coming and speaking with me today. I know I learned so much, and I'm hoping everyone listening to this episode also has learned a lot. Any last words at all?
I would just say don't wait till you're pregnant to receive pelvic floor physiotherapy. A lot of people wait for like, oh, when I'm pregnant, I'll go. And I'm like, you probably have pelvic floor dysfunction now, and you've normalized it as, I pee like every hour. That's normal, right? Like, oh, I just have a small bladder. That's normal, right? Or I have to wake up twice a night to pee. I'm like, nope, not normal, right? So a lot of people don't realize they have issues until they actually go and work with someone or even have a conversation with someone. It doesn't have to be in person, but we live in a stressful society. And when we carry stress, we clench areas of our body like our pelvic floor. And when you clench an area long enough, expect some kind of dysfunction. So don't wait till it's really bad. Go get a preventive assessment, especially if you have like coverage and benefits. What are you waiting for, right? And find someone who will listen to you and your story rather than just assume you came for the standard back pain treatment. Because you can Google that. You don't need to pay money to go see someone. You're going to pay to see someone one-on-one to get individualized support. So if they're just putting you on machines and leaving you in a room for 30 minutes, like, I'm sorry, but please, you can receive better support. There's
better
amazing
care.
practitioners out there. So you deserve like the best because you only have one body and one life, like let's take care of it.
Take care of it. Yeah.
Yeah.
This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art design for our show by LaShawn Benedict. The Public Health Insight Podcast is produced by PHI Media. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.